There's a lot to manage if you have diabetes. Checking your blood sugar, making healthy food choices, finding time to be active, taking medication, going to your doctor's appointment. With all that, your feet might be the last thing on your mind, but daily foot care is one of the best ways to prevent foot complication. About half of all people with diabetes have some kind of nerve damage in any part of your body, but nerves in your feet and legs are most often affected. Nerve damage can cause you to lose feelings in your feet. Hi everyone, welcome back to Living a Balanced Life with Julio. My name is Julia Depoko. I'm a certified diabetes educator and bariatric educator. On today's episode, I'm going to talk to you about diabetes and foot care. Please stay with me if you're interested.
Exclusive.
People with diabetes can develop many different foot problems. Even ordinary problems can get worse and lead to serious complications. Foot problems most often happens when there is nerve damage, also called neuropathy. This can cause tingling, pain, burning or stinging pain, or weakness in the foot. It can also cause loss of feeling in the foot, so you can injure your foot and not even feel it. Poor blood flow or changes in the shape of your feet or toes may also cause problems for you if you have diabetes. It's very important to take good care of your feet and see your doctor right away if you have any signs of foot problems. Some people with nerve damage have numbness, tingling, and pain, but others have no symptoms at all. Nerve damages can also lower your ability to feel pain, heat, or cold. Living without pain sounds pretty good, but when it comes to diabetes, it could be at a high cost. Pain is a way of telling you that something is wrong and that you should take care of yourself. If you don't feel pain in your feet, you may not notice any cut or blisters or sores or other problems. Small problem can then become a serious issue if it's not treated early. Some of the ways you can prevent nerve damage is by taking care of yourself. So if you have diabetes, that means that making sure your blood sugar is in control. Keeping your blood sugar at a good control will help prevent further damages to the feet and to the nerve. You can take care of your feet by following a healthy eating plan, including eating more fruits and vegetables and less sugar and salt. Get physically active. 10 to 20 minutes of physical activity a day is better for you than to go without doing any kind of physical activity. Take medicine as prescribed by your doctor. So when you're doing this, you're taking care of yourself, you're taking care of your diabetes, and that will help prevent complications, which foot issue is one of them. Anyone with diabetes can develop nerve damage, but these factors makes the risk of developing foot complication worse. Having blood sugar level that is harder to manage, having diabetes for a long period of time, especially if your blood sugar is often higher than your target rate, being overweight, being older than age 40, having high blood pressure, and having high cholesterol. Nerve damages along with poor blood flow, other diabetes complication puts you at a higher risk of developing foot ulcers that could get infected easily and not heal properly. If an infection doesn't get better with treatment, your foot or your toe or part of your leg may be amputated, which means it will be surgically removed to prevent the infection from spreading to other parts of your body to save your life. When you check your feet every day, you can catch problems early and get them treated right away. It's very important that early treatment greatly reduces your risk of amputation. So if you have diabetes, make sure that you're taking care of your feet because that will save you from other foot complications which can lead to amputation and other issues later on in life. So now that you know the importance of keeping your feet healthy when you have diabetes, let's talk about some of the healthy tips that can help you manage foot complications that can prevent issues later on in life. So one of the things you can do is to check your feet every day for cuts, redness, swelling, sores, blisters, corns, calluses, or any other changes to the skin or nail. Use a mirror if you can't see the bottom of your feet, or ask a family member or friend to help you. Wash your feet every day in warm water. Make sure it's warm water and not hot water. How you can test is you can use your elbow to check the water temperature to make sure that it's not hot, because if you already have neuropathy, you might not feel how hot the water is. So warm water to wash your feet. Don't soak your feet. So soaking your feet is like giving your feet a bacteria bath. It's not good for your feet, so make sure you're not soaking your feet. Dry your feet completely and apply lotion to the top and the bottom of your feet, but do not put it in between your toes because that can lead to infection. The moisture between your toes can cause infection. Never go barefoot, so always wear shoes and socks or slippers even when you're inside to avoid any injury, because when you have neuropathy and you step on something sharp, you might not feel it. Before you put shoes on, check that there isn't any pebbles or other objects inside your shoe and that the lining is smooth, because you don't want to damage your skin that way. Wear shoes that fit you well. For the best fit, on new shoes at the end of the day when your feet tend to be a little bit larger. So when you're buying shoes and you're going shopping, do it towards the evening, because at that time your feet is a little bit swell and it's bigger. So when you get the shoes, it will fit you later on perfectly. Break in your new shoes slowly. Wear them for an hour or two a day at the first until you're completely comfortable. Always wear socks with your shoes. Making sure that you're trimming your toenails straight across, greatly smoothing any shapes or edges with a nail filer is very important. Doctor or podiatrist or chiropodist trim your toenails if you can't see or reach your toenails. You want to avoid cutting yourself, because once again, this can lead to infection that can bring problems later on for you. If you notice that you have any corns or calluses on your feet, please do not remove it yourself. It's especially important that you don't use over-the-counter products to try to remove corns and calluses, because you can cause damage to your skin, can cause damage to your feet, and because you have diabetes and with the decreased circulation and neuropathy, the nerve damages, that can lead to bigger problems for you later on. So if you see any kind of deformity or anything you cannot remove by yourself, go to see your podiatrist or your chiropodist. Seek your doctor's attention so they can get the proper treatment that you need to prevent further damages for your feet. Besides you checking your feet every day, it's important that you get your healthcare providers to also check your feet. At least once a year, you should have your doctor, your chiropodist, or your podiatrist, or your diabetes educator check your feet. When they're checking your feet, they'll do complex exams, which will include checking for feeling and blood flow in your feet. To keep the blood flowing in your feet, when you are sitting down, pull your feet up and wiggle your toes for few minutes several times throughout the day. This will get the blood flowing and help you improve circulation, which then will help with any kind of foot complication that may develop later on. Be mindful when you're doing exercises. Make sure that you choose feet-friendly activities like walking, riding a bike, or swimming. Always check with your doctor about which activities are best for you and that you should avoid. To exercise, but you want to make sure that you're safe, that you don't cause any injuries to your feet. It's important to ask questions. So when you visit your doctor or your diabetes educator or your foot doctor, make sure that you ask them what else you could do to keep your feet healthy, to prevent complications that can lead to issues later on in life for you. It's important to check in with your doctor or your diabetes educator often to make sure that you are being safe and taking care of your feet. If you experience any of these symptoms, don't wait for your next appointment. See your doctor right away and get things checked out. If you have pain in your legs or cramping in your buttocks, thigh, or calves while you're exercising, if you have increased tingling, burning, or pain in your feet, loss of sense of touch or ability to feel heat or cold very well, a change in the shape of your feet over time, loss of hair on your toes, feet, and lower legs, dry, cracked skin on your feet, a change in the color and temperature of your feet, thickened yellow toenails, fungus infections such as athlete's foot between your toes, a blister, sore, ulcer, infection, corn, or ingrown toenails. These are all signs that there could be foot complications starting and you need to see your doctor right away. Most people with diabetes can prevent serious foot complications by making sure that they're following up regularly with their family doctor, their healthcare providers, to make sure that any problem that's starting early could be dealt with to prevent further complications of the feet. It's important to know the basics about foot care. Taking a look at your feet every day is a great way for you to start. Although it can hurt, diabetic nerve damage can also lessen your ability to feel pain, heat, and cold. Loss of feeling often means that you may not feel a foot injury. You could have a tack or sore in your toes and walk on it all day without even knowing it. You could get a blister and not feel it. You might not notice a foot injury until the skin breaks down and becomes infected. So making sure you're looking at your feet is a good way to keep your feet healthy. Nerve damage can also lead to changes in the shapes of your feet and toes. If your foot doesn't fit comfortably in regular shoes, ask your doctor or your diabetes educator to refer you to see a chiropodist or chiropodist who can get you fitted for proper shoes. And you can do this through the multiple insurances that you may have. Having diabetes can cause changes to the skin of your foot. At times, your feet may become very dry. The skin may feel thick and it can crack. This is a problem caused by nerve damages that affect your body's ability to control the oils and moisture in your foot. After you take a bath, make sure that you dry your feet and seal in the remaining moisture with a thin coat of plain petroleum jelly and unscented hard cream or other such products. Do not put oil or cream between your toes. The extra moisture can lead to infection. Also, don't soak your feet. It's very important that you don't soak your feet because this becomes like a bacteria bath for your foot, and if there's any kind of cracked or open sores, it can spread the infection. And that can also cause even more dry skin. Poor circulation can make your foot less able to fight infection and to heal. Diabetes causes blood vessels of the foot and leg to narrow and harden. Therefore, it's important for you to control some of the things that can cause poor blood flow. One of the things is make sure that if you smoke, to stop smoking. Smoking makes arteries harden faster. Also, follow your diabetes care team advice on keeping your blood pressure and cholesterol under control. These are all good ways to make sure that you are preventing major complications of diabetes, including your feet. If your feet are cold, you may want to warm them, but be careful. So it's important that if your feet is cold, that you warm them by wearing warm socks. So avoid using any hot water bottles or heating pads because it might cause burn on your skin. Sometimes some people may feel pain in their calves when they're walking fast up a hill or on a hard surface. Stop and rest for a few minutes to usually help with the pain. If you have these symptoms, you smoke, you may want to stop smoking. Working with your diabetes care team can get you started on walking programs that can help improve circulation. But for some people, sometimes with poor circulation, they might need medication. So anytime you feel any symptoms, anything different than your usual self, it's important for you to double check with your healthcare team to make sure that you're being safe. Exercise is a good way to improve poor circulation. It stimulates blood flow to the legs and feet. Walk in a steady, well-fitted, comfortable shoes. But don't walk when you have sores on your feet because that can put more pressure on it and it can lead to infection that can cause further damage to the feet. If you see that you have any kind of ulcer on your foot, it's important to get it checked right away. Do your best to control your blood sugar level so that your foot can heal properly. If you smoke, to quit smoking and do all the things that improves your health, because when your health is improved in terms of exercising, eating healthy, helps improve your blood sugar, which in turn help prevent any further damage or infection to your feet. People with diabetes are far more likely to have a foot or leg amputation than other people. The problem is many people with diabetes have peripheral artery disease, which reduces blood flow to the feet and can also cause a lot of damages to the feet. Also, many people with diabetes have neuropathy, which makes it so that you can't feel your feet. Together, these problems makes it easy to get ulcers and infection that may lead to amputation. Most amputation are preventable though. By checking your feet daily, regular care, and visit with your doctor and healthcare educator, it can help you get proper footwear to help prevent complications which can lead to amputation. For those reasons, take good care of your feet and see your doctor right away if you see any signs of foot problem. Always follow your doctor and diabetes educator advice when caring for your ulcers or your foot problems. One of the biggest threats to your feet is smoking. Smoking affects small vessels in your foot. It can cause a decreased blood flow to your feet and make your wound very slow and hard to heal. A lot of people with diabetes who needs amputation are usually smokers. So if you do smoke, do your best to reduce the amount of cigarettes you smoke per day to a point where you quit completely, because this will help improve your overall health, improve your complication, it will improve your heart health and prevent further damages and complication from diabetes. So let's recap on some of the important things that you should do when you have diabetes regarding your foot care. So if you have diabetes, check your feet every day for cuts, cracks, bruises, blisters, sores, infection, and unusual markings. Use a mirror to see the bottom of your feet if you can lift them up. Check the color of your feet. Make sure that there is no swelling, warmth, or redness. Or if you have any pain, see your doctor or foot care specialist right away. Clean a cut or scratch with a mild soap and water and cover it with dry dressing for sensitive skin. Trim your toenails straight across. Wash and dry your feet every day, especially between your toes. Apply a good skin lotion every day on the heel and on the soles of your feet. Wipe off any excess lotion. Change your socks every day. Always wear a good supportive shoe. Get professionally fitted shoe if it's required and if you need it. Choose shoes with low heels under 5 centimeters high. Buy shoes in the late afternoon since your feet swell slightly by then. Avoid extreme cold and heat, including the sun. Exercise regularly to improve circulation. See a foot care specialist if you need any advice or treatment. And make sure that you are following up with your diabetes educator, your healthcare providers, your chiropodist, your podiatrist at least once a year to get nerve tests done on your feet to make sure that there's no starting complications of foot issues because of your diabetes. Now that you know what to do to prevent foot complications, let's look at some of the don'ts. So things you should not do to cause foot complications. If you have diabetes, please do not do this. Do not cut your own toenails or calluses. See a chiropodist or a podiatrist to do that for you. Do not treat your own ingrown toenails. See your doctor to do that for you. You do not use over-the-counter medication to treat corns and warts. They are dangerous for people with diabetes because it can cause harm to your feet. Do not apply heat to your feet with hot water bottle or electric blankets. You could burn yourself because remember, when you have diabetes, neuropathy causes decreased sensation to your feet. So please do not do that. Do not soak your feet. Do not take hot baths because once again, you can burn yourself. Do not use lotion between your toes because that can cause fungal infection or other infection between your toes due to the increased moisture. Do not walk barefoot inside or outside the house. Do not wear tight socks or knee highs. Do not wear over-the-counter insole. They can cause blisters if they are not fitted right for you. So do not do that. Do not sit for a long period of time because when you sit for a long period of time, that can cause poor circulation, which can lead to pooling and edema and other foot complications. And lastly, if you smoke, please do not smoke because that makes circulation even worse and can cause peripheral vascular disease, which can cause foot complication later on for you. So do not smoke. Good foot care, like healthy skin, nail care, and proper footwear is very important for anyone with diabetes because you have a greater risk of having problems with your feet. But if you inspect your feet and take care of your feet every day, you can prevent many of these problems. I hope the information in this video has helped explain what you can do and what you shouldn't do when you have diabetes to keep your feet healthy. So until next time, take care of yourself, inspect your feet, eat healthy, exercise, do your best to keep yourself from any kind of complications from diabetes. Take care of yourself. Bye-bye.
Exclusive.